Sample NCLEX RN questions with rationale. Question 1. A client was involved in a motor vehicle accident and exhibits crepitus and decreased breath sounds on the left. Which of the following assessment findings should concern the nurse the most? Option A, a temperature of 102 degrees and a productive cough. Option B, arterial blood gas values within normal limits. Option C, a trachea deviating to the right. Option D, a barrel-chested appearance. The correct answer is option C, trachea deviating to the right. A mediastinal shift or tracheal deviation to the unaffected side is indicative of a tension pneumothorax and is a medical emergency. Question 2. A client is going to have an endoscopy performed. Which of the following is not a probable reason for an endoscopy procedure? Option A, aspiration noted on a thick diet. Option B, pain with a bowel movement. Option C, pain felt in the left upper quadrant. Option D, right shoulder pain. The correct answer is option B, pain with a bowel movement. Bowel movement pain should be examined with a colonoscopy rather than an endoscopy of the upper gastrointestinal tract. Question 3. A person using over-the-counter nasal decongestant drops who reports worsening nasal congestion should be instructed to: Option A, switch to a stronger dose of the medication. Option B, discontinue the medication for a few weeks. Option C, use the medication more frequently. Option D, use a combination of different medications. The correct answer is option B, discontinue the medication for a few weeks. Prolonged use of decongestant drops can lead to rebound congestion, which is relieved by discontinuing the medication for 2 to 3 weeks. Question 4. A mother is concerned about West Nile virus. What information should the nurse provide to help prevent her children from contracting the illness? Option A. The children should wear long sleeves and pants while outside. Option B. Apply insect repellent containing DEET when outside. Option C. Remove standing water from the property. Option D. All of the above. The correct answer is option D. All of the above. Prevention involves avoiding mosquito bites by wearing protective clothing and using repellent and removing breeding grounds like standing water. Question 5. A nurse has just started the evening shift on a surgical unit. Which of the following patients should the nurse check on first? Option A, the 75-year-old female scheduled for a procedure in 10 hours. Option B, the 34-year-old male with new-onset urinary incontinence after back surgery. Option C, the 21-year-old male with phantom pain after an amputation yesterday. Option D, the 27-year-old female who received a transfusion yesterday. The correct answer is option B, a 34-year-old male with new-onset urinary incontinence after back surgery. New-onset urinary incontinence following back surgery may indicate a serious neurological complication that requires immediate medical assessment. Question 6. A nurse working in a pediatric clinic observes the following situations. Which of the following may indicate a developmental delay to the nurse? Option A, a 12-month-old child that does not cruise. Option B, an 8-month-old child that can sit upright unsupported. Option C, the 6-month-old child that is rolling from prone to supine. Option D, a 3-month-old child that does not roll from supine to prone. The correct answer is option A, a 12-month-old child that does not cruise. By 12 months of age, a child should at least be cruising or holding on to objects to walk as a precursor to independent walking. Question 7. Issues addressed by hospital ethics committees include all of the following except: Option A, the non-payment of hospital bills. Option B, euthanasia. Option C, starting or stopping medical treatment. Option D, the use of feeding tubes. The correct answer is option A, non-payment of hospital bills. Ethics committees deal with moral and end-of-life dilemmas rather than financial matters such as billing and payment. Question 8. A client is in septic shock and has a potential clotting disorder. Which of the following entries is inappropriate for the nursing care plan? Option A, obtain an order for a stool softener. Option B, administer packed red blood cells if ordered. Option C, use an oral sponge for teeth cleaning. Option D, apply pressure to venipuncture sites for only 1 minute. The correct answer is option D, apply pressure to venipuncture sites for only 1 minute. Because of clotting abnormalities, pressure should be applied to venipuncture sites for 3 to 7 minutes to prevent excessive bleeding. Question 9. Which of the following arterial blood gas values indicates a patient may be experiencing a condition of metabolic acidosis? Option A, oxygen saturation at 90%. Option B, bicarbonate at 15 milliequivalents per liter. Option C, carbon dioxide at 47 millimeters of mercury. Option D, a pH of 7.34. The correct answer is option B, bicarbonate at 15 milliequivalents per liter. A bicarbonate value below 22 milliequivalents per liter indicates metabolic acidosis. Question 10. A client begins bleeding from the site of a previous arterial blood gas draw on the right wrist. What should the nurse do first? Option A, check the complete blood count. Option B, apply pressure to the site. Option C, document the bleeding in the chart. Option D, monitor the bleeding for 10 minutes. The correct answer is option B, apply pressure to the site. The immediate priority is to apply direct pressure to the site to stop the bleeding and prevent further blood loss. Question 11. A nurse is instructed to place an intravenous line in a patient with active tuberculosis and human immunodeficiency virus. The nurse should wear: Option A, sterile gloves and a mask and goggles. Option B, a surgical cap and gloves and a mask. Option C, double gloves and a gown and a mask. Option D, goggles and a mask and gloves and a gown. The correct answer is option D, goggles and a mask and gloves and a gown. Full personal protective equipment including eye protection and a gown and gloves and a mask is required when there is a risk of exposure to blood and airborne pathogens. Question 12. A husband is surprised that his wife has become very withdrawn during hospitalization for pneumonia. Which response helps the husband understand this behavior? Option A, hospitalization might cause a crisis so as she had to cope with problems before. Option B, some people react that way and she will talk more when she feels better. Option C, your wife might be concerned that she cannot fulfill her normal roles. Option D, this is typical behavior for someone who is as ill as your wife. The correct answer is option A, hospitalization might cause a crisis so as she had to cope with problems before. Hospitalization can precipitate a crisis and the nurse's response invites the husband to explore his wife's previous coping mechanisms. Question 13. A client has thick green drainage around his eyelids. What general information should the nurse seek first during the health history? Option A, a type of employment and environmental exposures. Option B, burning or itchy sensation in the eyes. Option C, position of the eyelids. Option D, existence of floaters in the vision. The correct answer is option A, type of employment and environmental exposures. Information about employment and environmental irritants is part of a general health history to identify potential causes of eye irritation. Question 14. A patient has been diagnosed with diabetes mellitus. Which of the following is not a common clinical sign of diabetes mellitus? Option A, the excessive hunger or polyphagia. Option B, excessive urination or polyuria. Option C, metabolic acidosis. Option D, lower extremity edema. The correct answer is option D, lower extremity edema. Polyphagia and polyuria and metabolic acidosis are classic signs of diabetes, but lower extremity edema is not a primary diagnostic sign. Question 15. A nurse is reviewing a patient's electrocardiogram report which shows a flat T wave and depressed ST segment. Which medication can cause these effects? Option A, morphine. Option B, atropine. Option C, nifedipine. Option D, digitalis. The correct answer is option D, digitalis. Digitalis can cause specific changes on an electrocardiogram including ST segment depression and T wave changes. Question 16. Which of the following developmental milestones for a 6-month-old child should be screened by the nurse during a routine visit? Option A, standing while holding on to something. Option B, rolling over. Option C, sitting up without support. Option D, creeping on the floor. The correct answer is option B, rolling over. Rolling over is a milestone typically achieved between 4 and 6 months of age. Question 17. A patient has recently been prescribed clonazepam for the first time. Which of the following side effects is not commonly associated with this drug? Option A, drowsiness. Option B, ataxia. Option C, elevated salivation. Option D, double vision. The correct answer is option D, double vision. Drowsiness and ataxia and increased salivation are known side effects of clonazepam, but double vision is not a primary side effect. Question 18. A case management clinical pathway for congestive heart failure might include all of the following except: Option A, physician follow-up appointments with transportation. Option B, client education regarding medication use. Option C, a nutritional consult for diet review. Option D, insurance review for reimbursement. The correct answer is option D, insurance review for reimbursement. Clinical pathways focus on care outcomes and education rather than the administrative process of insurance reimbursement. Question 19. A college student has just learned she contracted genital herpes. Which data is least likely to be included in the initial assessment? Option A, avoiding patterns. Option B, characteristics of lesions. Option C, vaginal discharge. Option D, prior history of chickenpox. The correct answer is option D, prior history of chickenpox. Voiding patterns and lesion characteristics and discharge are relevant to genital herpes, but a history of chickenpox is not directly related. Question 20. A nurse is caring for a patient with burns to the right lower extremity. According to the rule of nines, what percent describes this injury? Option A, 36%. Option B, 27%. Option C, 18%. Option D, 9%. The correct answer is option C, 18%. According to the rule of nines, each lower extremity accounts for 18% of the total body surface area. Question 21. A nurse is screening a patient who was recently cast on the left leg. Which of the following statements should the nurse be most concerned about? Option A. I did not keep my leg elevated like the doctor asked. Option B. I have been having pain in my left calf. Option C. My left leg has really been itching. Option D. The arthritis in my wrists is flaring up from the crutches. The correct answer is option B. I have been having pain in my left calf. Calf pain in a cast extremity can indicate a serious neurovascular complication or deep vein thrombosis that requires immediate attention. Question 22. Why is it often necessary to draw a complete blood count when a client is treated with an antiepileptic drug? Option A. The hematocrit is affected by increased vascular volume. Option B. Antiepileptic drugs increase the risk of infection. Option C. Antiepileptic drugs induce white blood cell reduction. Option D. A side effect of some antiepileptic drugs is blood dyscrasia. The correct answer is option D. A side effect of some antiepileptic drugs is blood dyscrasia. Some antiepileptic drugs can cause serious blood disorders like aplastic anemia, which necessitates regular blood count monitoring. Question 23. A newborn baby exhibits a reflex that includes hand opening and abducted extremities following a jarring motion. This is the Option A, asymmetric tonic neck reflex. Option B, startle reflex. Option C, grasping reflex. Option D, Moro reflex. The correct answer is option D, Moro reflex. The Moro reflex is a normal neonatal response to a sudden loss of support or a jarring motion. Question 24. A legal right to confidentiality of client health information is waived when: Option A, a court system subpoenas the information. Option B, a family member requests the information. Option C, a living will takes effect. Option D, the client is declared incompetent. The correct answer is option A, a court system subpoenas the information. Confidentiality is legally waived when a court subpoenas records or when mandatory reporting of certain illnesses is required by law. Question 25. Signs of internal bleeding include all of the following except: Option A, painful or swollen extremities. Option B, a tender and rigid abdomen. Option C, a vomiting bile. Option D, a bruising of the skin. The correct answer is option C, vomiting bile. Internal bleeding is characterized by swelling and abdominal rigidity and bruising, but vomiting bile is usually a sign of a gastrointestinal issue. Question 26. A child with Down syndrome has weak muscles and diminished reflexes. Which of the following actions should the nurse take first? Option A. Contact the physician immediately. Option B. Send the patient to X-ray for a neck workup. Option C. Start an intravenous line on the patient. Option D. Position the child's neck in a neutral position. The correct answer is option D. Position the child's neck in a neutral position. The child may have an atlantoaxial dislocation, so the neck should be stabilized in a neutral position before contacting the physician. Question 27. A woman remembers childhood sexual abuse. Which of the following goals should the nurse include for this client? Option A. Prosecuting the perpetrator. Option B. Managing symptoms of anxiety and fear. Option C. Determining if the memories are real. Option D. Collaborating the client's story. The correct answer is option B. Managing symptoms of anxiety and fear. The nurse's role is to help the client manage the psychological stress and anxiety caused by the recall of the trauma. Question 28. A nurse is taking a patient's history and realizes the patient is complaining of shortness of breath and weakness. Which of the following may be occurring? Option A. The patient is developing congestive heart failure. Option B. The patient may be having a myocardial infarction. Option C. The patient may be developing chronic obstructive pulmonary disease. Option D. The patient may be having an onset of peripheral vascular disease. The correct answer is option B. The patient may be having a myocardial infarction. Shortness of breath and muscle weakness are symptoms that can be associated with an acute myocardial infarction. Question 29. A male client with dizziness has an order for intravenous morphine. What should the nurse do first? Option A. Check the patient's chest X-ray results. Option B. Retake vital signs including blood pressure. Option C. Perform a neurological screen on the patient. Option D. Request the physician on call assess the patient. The correct answer is option B. Retake vital signs including blood pressure. Dizziness can be a sign of hypotension, which is a potential contraindication or risk factor when administering morphine. Question 30. A girl is admitted to the emergency room with lower right abdominal discomfort. What should the nurse do first? Option A. Administer pain medication. Option B. Place the patient in a right side lying position. Option C. Start a central line. Option D. Provide pain reduction techniques without medication. The correct answer is option D. Provide pain reduction techniques without medication. Pain medication should not be given until a diagnosis is made to avoid masking symptoms, and the nurse should use non-pharmacological techniques. Question 31. A patient with a history of cardiac arrhythmia is ordered to receive 2 units of blood. The nurse should: Option A. Pre-medicate the patient with pain medication. Option B. Notify the family via the telephone. Option C. Decrease the temperature of the blood. Option D. Increase the temperature of the blood using a warmer. The correct answer is option D. Increase the temperature of the blood using a warmer. Warming the blood to body temperature reduces the risk of further cardiac arrhythmias during the transfusion. Question 32. A patient who delivered a baby 3 days ago reports white patches on her breast. Which of the following medications may be necessary? Option A. Anistatin. Option B. Atropine. Option C. Amoxicillin. Option D. Hydrocodone. The correct answer is option A. Nystatin. White patches may indicate a fungal infection like thrush, which is treated with antifungal medications like Nystatin. Question 33. A nursing advocate is one who: Option A. Makes decisions for others. Option B. Encourages persons to make decisions and acts on their behalf. Option C. Manages the care of others. Option D. Is the legal representative for a person. The correct answer is option B. Encourages persons to make decisions and acts on their behalf. Advocacy involves supporting the client's right to self-determination and helping them make informed decisions. Question 34. Which question is appropriate when assessing a client's self-expectations about weight loss? Option A. What makes you think you can change your habits? Option B. How do you feel about losing weight? Option C. How important is it that you lose weight? Option D. What do you think is a realistic weekly weight loss for you? The correct answer is option D. What do you think is a realistic weekly weight loss for you? Assisting the client to set attainable and realistic goals is an essential part of a therapeutic nurse-client relationship. Question 35. Which of the following is not considered one of the main mechanisms of type 2 diabetes treatment? Option A. Oral medications. Option B. Balanced nutrition. Option C. Increased physical activity. Option D. A continuous insulin therapy. The correct answer is option D. Continuous insulin therapy. Type 2 diabetes is primarily managed with lifestyle changes and oral meds, although insulin may be used if other methods fail. Question 36. A nurse is implementing a campaign about accidental poisoning. What should she teach as the first action? Option A. The child should be given milk. Option B. The child should be given syrup of ipecac. Option C. The poison control center should be contacted. Option D. The child should be taken to the emergency room. The correct answer is option C. The poison control center should be contacted. The first step in any suspected poisoning is to contact the local poison control center for specific instructions. Question 37. Chemotherapeutic agents often produce leukopenia, which is delayed several days or weeks because option A. The hemoglobin and hematocrit are normal. Option B. Red blood cells are affected first. Option C. Folic acid levels are normal. Option D. Circulating white cells are not immediately affected. The correct answer is option D. Circulating white cells are not immediately affected. Chemotherapy affects the maturation of new cells in the bone marrow, and it takes time for current circulating cells to be cleared. Question 38. Which of the following scenarios would indicate an abnormal serum glucose value for a 30-year-old male? Option A. 70 mg per deciliter. Option B. 55 mg per deciliter. Option C. 110 mg per deciliter. Option D. 100 mg per deciliter. The correct answer is option B. 55 mg per deciliter. A glucose level of 55 mg per deciliter is below the normal range of 60 to 115. Question 39. A 6-month-old infant has abrasions and petechiae of the palate. The nurse should: option A. Inquire about foods the child is eating. Option B. Ask about the possibility of sexual abuse. Option C. A request to see the type of bottle used. Option D. Question the parent about toys. The correct answer is option B. Ask about the possibility of sexual abuse. Injuries to the soft palate in an infant are a high-risk indicator for potential sexual abuse and must be assessed. Question 40. A patient with a herniated disc is able to walk with reduced spasms after 24 hours. Which medication was most beneficial? Option A. Mivacurium. Option B. Atropine. Option C. Bethanacol. Option D. Cyclobenzaprine. The correct answer is option D. Cyclobenzaprine. Cyclobenzaprine is a muscle relaxant used for the treatment of acute muscle pain and spasms. Question 41. A patient has just been prescribed prazosin to control hypertension. The nurse should instruct the patient to observe for: option A. The dizziness and lightheadedness. Option B. Weight gain. Option C. Sensory changes in the legs. Option D. Fatigue. The correct answer is option A. Dizziness and lightheadedness. Prazosin can cause orthostatic hypotension, which results in dizziness when changing positions. Question 42. A nurse is ordered to set up buccal traction for a femur fracture. Which of the following applies to this traction? Option A. A weight greater than 10 pounds should be used. Option B. The line of pull is upward at an angle. Option C. The line of pull is straight along the long axis. Option D. A weight greater than 20 pounds should be used. The correct answer is option C. The line of pull is straight along the long axis. Buccal traction uses a straight line of pull to maintain alignment and reduce muscle spasms. Question 43. The acts enacted by states to provide immunity to persons who provide emergency care at an accident scene are called: Option A, Good Samaritan Laws. Option B, Health Insurance Portability and Accountability Act. Option C, Patient Self-Determination Act. Option D, Omnibus Budget Reconciliation Act. The correct answer is option A, Good Samaritan Laws. Good Samaritan laws protect healthcare providers who stop to assist in an emergency situation from legal liability. Question 44. The intensive care unit nurse caring for a client who was declared brain dead can expect to find organ donation wishes. Option A, on the driver's license. Option B, in a safety deposit box. Option C, in the last will and testament. Option D, on the insurance card. The correct answer is option A, on the driver's license. In most states, the driver's license is the most accessible place to find documented evidence of organ donor status. Question 45. Which of the following clinical signs would not apply to a condition of respiratory alkalosis? Option A, muscle tetany. Option B, fainting or syncope. Option C, numbness. Option D, anxiety. The correct answer is option D, anxiety. Anxiety is more commonly a clinical sign or cause of respiratory acidosis rather than a symptom of alkalosis. Question 46. A nursing care plan for a client with sleep problems has been implemented. Which of the following is not an expected outcome? Option A, the client reports no episodes of awakening. Option B, the client falls asleep within 1 hour of going to bed. Option C, the client reports satisfaction with sleep amount. Option D, the client rates sleep as an 8 or more. The correct answer is option B, the client falls asleep within 1 hour of going to bed. An expected outcome is that the client falls asleep shortly after going to bed rather than taking up to an hour. Question 47. A nurse gave medications to the wrong client. What is the appropriate documentation? Option A, note in medication records the drug given. Option B, a do not document if the client was not hurt. Option C, note the client's orientation. Option D, completely fill out an incident report. The correct answer is option D, completely fill out an incident report. An incident report must be completed for any medication error regardless of whether the client was harmed. Question 48. A woman in labor is alone and upset that her family is not there. Which approach should the nurse take first? Option A, task if another individual wants to be her support person. Option B, assure her that the nurse will be there at all times. Option C, tell her the nurse will try to locate the family. Option D, reinforce her confidence in her own ability. The correct answer is option A, ask if another individual wants to be her support person. Offering to call another support person helps meet the client's immediate emotional needs while her family is away. Question 49. When giving an intramuscular injection to an infant, which of the following sites is preferred? Option A, a ventrogluteal region. Option B, deltoid. Option C, vastus lateralis. Option D, dorsogluteal region. The correct answer is option C, vastus lateralis. The vastus lateralis muscle in the thigh is the preferred site for intramuscular injections in infants. Question 50. A client taking ciprofloxacin for prostatitis develops severe muscle pain. This adverse reaction may indicate: Option A, electrolyte imbalance. Option B, impending tendon rupture. Option C, calcium deposits. Option D, antibiotic-associated colitis. The correct answer is option B, impending tendon rupture. Quinolone antibiotics like ciprofloxacin are associated with a rare but serious risk of tendon rupture. Question 51. A 93-year-old female with Alzheimer's shows increased confusion and gait instability. What should the nurse suggest? Option A, keep the patient in her room at all times. Option B, bring family pictures to the patient's room. Option C, recommend a speech therapy consult. Option D, have the patient walk by pushing the wheelchair. The correct answer is option B, bring family pictures to the patient's room. Familiar objects like pictures can provide sensory stimulation and help reduce confusion in Alzheimer's patients. Question 52. A patient asks if they can sit up during a magnetic resonance imaging scan of the brain. The nurse's correct response is Option A. I will talk to the doctor about it. Option B. You will be in the reverse Trendelenburg position. Option C. The radiologist will let you know. Option D. You will have to lie down on your back. The correct answer is option D. You will have to lie down on your back. Magnetic resonance imaging of the brain requires the patient to remain still in a supine position. Question 53. Appropriate care for a client with neutropenia includes Option A. Plenty of fresh fruits and vegetables. Option B. The semi-private room. Option C. Wearing a mask when out of the room. Option D. Routine hand washing. The correct answer is option C. Wearing a mask when out of the room. Neutropenic clients are at high risk for infection and must wear a mask when leaving their room for protection. Question 54. A nurse is administering an antibiotic to a 4-year-old who does not have an identification bracelet. What should the nurse do? Option A. Ask another staff member who the child is. Option B. Ask the child's mother to state the child's name. Option C. Ask the child for her name. Option D. Withhold the medication until a bracelet is made. The correct answer is option B. Ask the child's mother to state the child's name. Asking the parent to identify the child is a safe way to verify identity when a bracelet is missing. Question 55. Which of the following statements is most applicable when discussing Guillain-Barré syndrome with a patient? Option A. It gets better after 5 years in all cases. Option B. It causes limited sensation in the abdomen. Option C. It causes muscle weakness in the legs. Option D. It does not affect breathing in severe cases. The correct answer is option C. It causes muscle weakness in the legs. Guillain-Barré syndrome is characterized by ascending muscle weakness that typically starts in the lower extremities. Question 56. Spirituality affects a client's life in all of the following areas except Option A. Nutritional intake. Option B. Ability to handle stress. Option C. Sexual expression. Option D. Genetic makeup. The correct answer is option D. Genetic makeup. Spirituality is a personal belief system and does not have any influence on an individual's genetic composition. Question 57. A nurse is reviewing a patient's medical record which indicates limited shoulder flexion. Which plane of movement is limited? Option A. Horizontal. Option B. Sagittal. Option C. Frontal. Option D. Vertical. The correct answer is option B. Sagittal. Flexion and extension occur in the sagittal plane of movement. Question 58. A patient has returned from a heart catheterization and wants to start walking 3 hours later. The nurse should Option A. Tell the patient to remain with the leg straight for another hour. Option B. Allow the patient to begin limited ambulation. Option C. Recommend a physical therapy consultation. Option D. Tell the patient to remain with the leg straight for 6 more hours. The correct answer is option A. Tell the patient to remain with the leg straight for another hour. Following a heart catheterization, the patient must keep the affected leg straight for at least 4 hours to prevent bleeding. Question 59. A head injury to an adult client causes the client to sleep for long periods of time. This indicates injury to the Option A. Hypothalamus. Option B. Thalamus. Option C. Cortex. Option D. Medulla. The correct answer is option A. Hypothalamus. The hypothalamus regulates sleep-wake cycles, and injury to this area can disrupt normal sleep patterns. Question 60. Which of the following vaccines is a live virus? Option A. Varicella. Option B. Inactivated polio vaccine. Option C. Diphtheria and tetanus and acellular pertussis. Option D. Hepatitis B. The correct answer is option A. Varicella. Varicella and the oral polio vaccine are live virus vaccines, whereas the others are inactivated or subunit vaccines. Question 61. If a patient is acutely psychotic, which of the following independent nursing interventions is not appropriate? Option A. Conveying calmness with one-on-one interaction. Option B, dealing with your own feelings of anxiety. Option C, encourage participation in group therapy. Option D, listen and identify causes of behavior. The correct answer is option C, encourage participation in group therapy. Acutely psychotic patients are often too disorganized for group therapy and may disrupt the group process. Question 62. An 85-year-old client is eligible for Medicare reimbursable home care if they meet which criteria? Option A, homebound status requiring skilled care. Option B, immediate previous hospitalization. Option C, specific age requirements. Option D, requirement of social work support only. The correct answer is option A, homebound status requiring skilled care. Medicare home care requires the client to be homebound and in need of a skilled nursing or therapy service. Question 63. A patient is complaining of severe chest pain during a stress test. Which medication is most appropriate for relief? Option A, aspirin. Option B, diazoxide. Option C, nifedipine. Option D, mannitol. The correct answer is option C, nifedipine. Nifedipine can provide rapid relief of ischemic chest pain during a cardiovascular event. Question 64. A nurse notices a mole with irregular edges and a bluish color on a patient after heart surgery. The nurse should: Option A, recommend a dermatological consult to the doctor. Option B, to note the location and call the physician. Option C, note the location and follow up via the medical record and phone call. Option D, remove the mole using a debridement technique. The correct answer is option C, note the location and follow up via the medical record and phone call. Suspicious moles should be documented and reported to the attending physician for further evaluation for melanoma. Question 65. The difference between spirituality and religion is that spirituality is: Option A, a belief about a higher power. Option B, an individual's relationship with a higher power. Option C, organized worship. Option D, the belief in an invisible energy. The correct answer is option B, an individual's relationship with a higher power. Spirituality is a personal relationship with a higher power, while religion is a structured system of organized beliefs. Question 66. Which of the following is not a contraindication for immunization? Option A, seizures. Option B, a fever for more than 3 days. Option C, a malignancy for more than 3 months. Option D, a chronic illness for more than 6 months. The correct answer is option D, chronic illness for more than 6 months. Chronic conditions are generally not contraindications for receiving routine immunizations. Question 67. Which of the following phone calls to an outpatient clinic should have the highest priority? Option A, a patient with heel skin breakdown. Option B, a patient who cannot feel their fingers in a new cast. Option C, a female who thinks she sprained her ankle 2 weeks ago. Option D, a patient whose knee still hurts after surgery. The correct answer is option B, a patient who cannot feel their fingers in a new cast. Loss of sensation in a cast extremity is a sign of neurovascular compromise and is a medical emergency. Question 68. A widower is hospitalized with apprehension and a sense of impending doom. What is the best response? Option A, you have nothing to worry about and you are safe. Option B, has anything happened recently that might have triggered these feelings? Option C, we have given you medication for your anxiety. Option D, take some deep breaths and try to calm down. The correct answer is option B. Has anything happened recently that might have triggered these feelings? Exploring potential triggers for anxiety helps the client gain insight and allows the nurse to provide targeted support. Question 69. A client on Floxin must be alerted to which of the following adverse effects? Option A, stunting of height in teens. Option B, propensity for uterine bleeding. Option C, intractable diarrhea. Option D, tendon rupture. The correct answer is option D, tendon rupture. Quinolone antibiotics like Floxin have a rare but serious side effect of causing tendon rupture. Question 70. Which of the following substances need to be assessed when completing a family health assessment? Option A, coffee and tea and cola and cocoa. Option B, alcohol and tobacco and illegal substances. Option C, medicines prescribed by a physician. Option D, all of the above. The correct answer is option D, all of the above. A thorough health assessment must include all legal and illegal substances as well as dietary stimulants. Question 71. The nurse wants to test the function of cranial nerve 7. Which of the following is the most appropriate procedure? Option A, test taste on the back of the tongue. Option B, test taste on the front of the tongue and facial muscle activation. Option C, test sensation of the face and back of the tongue. Option D, test sensation of the face and front of the tongue. The correct answer is option B, test taste on the front of the tongue and facial muscle activation. Cranial nerve 7 or the facial nerve is responsible for taste on the anterior tongue and motor control of the face. Question 72. Which of the following microorganisms are considered normal body flora? Option A, a staphylococcus on the skin. Option B, a streptococcus in the nares. Option C, Candida albicans in the vagina. Option D, Pseudomonas in the blood. The correct answer is option A, Staphylococcus on the skin. Staphylococcus is a common inhabitant of the skin while the other microorganisms are usually associated with infection. Question 73. A nurse is caring for a patient in the step-down unit with signs of increased intracranial pressure. Which is not a sign? Option A, bradycardia. Option B, increased pupil size bilaterally. Option C, change in the level of consciousness. Option D, vomiting. The correct answer is option B, increased pupil size bilaterally. Increased intracranial pressure usually causes unilateral rather than bilateral pupil changes in the early stages. Question 74. The nurse is developing a care plan for severe anxiety. An appropriate measurable outcome is that the client should: Option A, have decreased anxiety. Option B, talk to the nurse for 10 minutes. Option C, sit quietly for 30 minutes. Option D, develop an adaptive coping mechanism. The correct answer is option B, talk to the nurse for 10 minutes. A measurable outcome must be specific, and talking for 10 minutes is a realistic and quantifiable goal. Question 75. A patient has symptomatic bradycardia. Which medication is most recognized for treatment? Option A, cholestyramine. Option B, digitalis. Option C, nitroglycerin. Option D, atropine. The correct answer is option D, atropine. Atropine is used to increase the heart rate by improving conduction through the atrioventricular node. Question 76. A family member asks about the prognosis of schizophrenia. The nurse's response is based on the knowledge that: Option A, it affects women more than men. Option B, it is usually diagnosed between ages 15 and 45. Option C, it is a chronic disease with periods of remission. Option D, it is diagnosed later in women. The correct answer is option C, it is a chronic disease with periods of remission. Schizophrenia is typically a lifelong chronic condition characterized by exacerbations and remissions. Question 77. A nurse finds a client unresponsive. After shaking and calling the name without a response, what should the nurse do next? Option A, open the airway. Option B, give defibrillation. Option C, check the pulse. Option D, call for help. The correct answer is option D, call for help. The first step in responding to an unresponsive individual is to activate the emergency response system or call for help. Question 78. A nurse is reviewing lithium levels. Which of the following values is outside the therapeutic range? Option A, 1.0 milliequivalents per liter. Option B, 1.1 milliequivalents per liter. Option C, 1.2 milliequivalents per liter. Option D, 1.3 milliequivalents per liter. The correct answer is option D, 1.3 milliequivalents per liter. The standard therapeutic range for lithium is 0.6 to 1.2 milliequivalents per liter. Question 79. When planning care for amphetamine abuse, the nurse should know that: Option A, amphetamines increase dopamine levels at neural synapses. Option B, amphetamines have a low risk of addiction. Option C. Amphetamines produce a rush followed by a 2-hour high. Option D. The addiction to barbiturates and amphetamines is rare. The correct answer is option A. Amphetamines increase dopamine levels at neural synapses. Amphetamines increase dopamine and norepinephrine, which causes stimulation of the central nervous system. Question 80. What is the appropriate ratio of cardiac compressions to ventilations in an adult for one-person cardiopulmonary resuscitation? Option A, 5 to 1. Option B, 1 to 5. Option C, 15 to 2. Option D, 2 to 15. The correct answer is option C, 15 to 2. The current standard for single-person adult cardiopulmonary resuscitation is 15 compressions to 2 breaths. Question 81. A surgical patient is experiencing shortness of breath and calf pain with warmth. These factors indicate: Option A, the patient may have a deep vein thrombosis. Option B, the patient is exhibiting signs of dermatitis. Option C, the patient is in the late phases of congestive heart failure. Option D, the patient is experiencing postoperative anxiety. The correct answer is option A, the patient may have a deep vein thrombosis. Calf pain and warmth and swelling are classic signs of a deep vein thrombosis. Question 82. A client with borderline personality disorder frequently attempts self-harm. The best intervention is: Option A, constant observation to prevent self-harm. Option B, enlisting the client in defining harmful behaviors. Option C, checking on the client every 15 minutes. Option D, removing all dangerous items from the room. The correct answer is option B, enlisting the client in defining harmful behaviors. Actively involving the client in identifying triggers for self-harm is a more effective long-term therapeutic strategy. Question 83. What should the nurse include in a fall prevention teaching plan for an 85-year-old female? Option A, remove scatter rugs and minimize clutter. Option B, the client should not get up and move around the house. Option C, a raised toilet seat is not needed if she can walk. Option D, wear socks while walking in the house. The correct answer is option A, remove scatter rugs and minimize clutter. Removing hazards like rugs and clutter is the most effective way to prevent falls in the home. Question 84. A nurse requires human immunodeficiency virus prophylaxis after a needle puncture. Which regimen should be used? Option A, an antibiotic and a protease inhibitor. Option B, 2 non-nucleoside reverse transcriptase inhibitors. Option C, 1 protease inhibitor. Option D, 2 protease inhibitors. The correct answer is option B, 2 non-nucleoside reverse transcriptase inhibitors. The standard initial prophylaxis according to guidelines is 2 non-nucleoside reverse transcriptase inhibitors. Question 85. Which of the following is the correct order of sensations experienced with an ice water bath? Option A, cold and burning and aching and numbness. Option B, burning and aching and cold and numbness. Option C, aching and cold and burning and numbness. Option D, cold and aching and burning and numbness. The correct answer is option A, cold and burning and aching and numbness. The body typically perceives cold first, followed by burning and aching, and finally numbness. Question 86. In hanging gravity intravenous fluid, which tubing is a microdrop set? Option A, of 15 drops per milliliter. Option B, 60 drops per milliliter. Option C, 20 drops per milliliter. Option D, 10 drops per milliliter. The correct answer is option B, 60 drops per milliliter. Microdrop tubing is standardized at 60 drops per milliliter, while macrodrop sets provide larger drops. Question 87. A patient's lower extremity is warm to the touch and red and swollen with a low fever. This condition is most likely: Option A, herpes. Option B, a scleroderma. Option C, dermatitis. Option D, cellulitis. The correct answer is option D, cellulitis. Redness and warmth and swelling with a fever are classic signs of cellulitis, which is an infection of the skin. Question 88. Which of the following medications is not considered a neuromuscular blocker? Option A, succinylcholine. Option B, pancuronium. Option C, vasopressin. Option D, mivacurium. The correct answer is option C, vasopressin. Vasopressin is a hormone replacement medication rather than a neuromuscular blocking agent. Question 89. Which laboratory test is ordered to determine if a client is tolerating total parenteral nutrition? Option A, a triglyceride level. Option B, liver function tests. Option C, a glucose tolerance test. Option D, a complete blood count. The correct answer is option B, liver function tests. Liver function tests are used to monitor the organ's ability to process the nutrients provided in total parenteral nutrition. Question 90. Which statement about spinal cord injury bowel management indicates a need for further teaching? Option A. I should avoid eating foods that produce gas. Option B. I should drink more fluids like coffee and cola. Option C. I should set a regular schedule for bowel movements. Option D. I should sit in an upright position for bowel movements. The correct answer is option B. I should drink more fluids like coffee and cola. Caffeinated fluids act as diuretics and can cause dehydration, which is counterproductive for bowel management. Question 91. Which of the following motions refers to turning the palm of the hand over to face anteriorly? Option A, pronation. Option B, supination. Option C, abduction. Option D, adduction. The correct answer is option B, supination. Supination is the movement that turns the palm upward or forward. Question 92. A client takes a medication metabolized by the liver and starts a second drug that induces the liver enzyme system. Monitor for Option A, increased therapeutic effects of the first drug. Option B, increased adverse effects of the second drug. Option C, decreased therapeutic effects of the first drug. Option D, decreased therapeutic effects of the second drug. The correct answer is option C, decreased therapeutic effects of the first drug. Inducing the enzyme system increases the metabolism of the first drug, which reduces its effectiveness in the body. Question 93. People-related supervisory tasks include all of the following except Option A, coaching. Option B, encouraging. Option C, target setting. Option D, rewarding. The correct answer is option C, target setting. Target setting is a task-related responsibility focused on goals, while the other options involve direct employee interaction. Question 94. A client is having a petit mal seizure on the clinic floor. Which of the following has the highest priority? Option A, provide a safe environment free of obstructions. Option B, call a code. Option C, contact the patient's physician. Option D, prevent excessive movement of the extremities. The correct answer is option A, provide a safe environment free of obstructions. Ensuring the environment is safe and clear of hazards is the immediate priority during a seizure. Question 95. The best nursing diagnosis for a client with newly diagnosed diabetes mellitus is Option A, impaired skin integrity. Option B, knowledge deficit related to new diagnosis. Option C, alteration in nutrition more than body requirements. Option D, fluid volume deficit. The correct answer is option B, knowledge deficit related to new diagnosis. The priority for a newly diagnosed client is education on managing the disease and medications. Question 96. A client receives a cervical radium implant for therapy. A common side effect of this implant is Option A, a creamy pink tinged vaginal drainage. Option B, stomatitis. Option C, constipation. Option D, a dry mouth or xerostomia. The correct answer is option A, creamy pink tinged vaginal drainage. Vaginal drainage that is pink and creamy is a common side effect for several months after an implant removal. Question 97. Which of the following arterial blood gas values indicates respiratory alkalosis? Option A, normal bicarbonate and elevated pH and low carbon dioxide. Option B, elevated pH and elevated carbon dioxide. Option C, low pH and low carbon dioxide. Option D, low pH and normal carbon dioxide. The correct answer is option A, normal bicarbonate and elevated pH and low carbon dioxide. Respiratory alkalosis is characterized by an increased pH and a decreased level of carbon dioxide. Question 98. Which statement by an elderly client raises the suspicion of financial abuse? Option A. I am having difficulty paying for this new antibiotic. Option B. I am short on cash since my daughter moved in to help me. Option C. I have not felt like shopping since the weather got worse. Option D. It is difficult to make ends meet on a fixed income. The correct answer is option B. I am short on cash since my daughter moved in to help me. Sudden changes in financial status after a family member moves in can be a red flag for financial exploitation. Question 99. Which intervention should the nurse perform when a client is restrained? Option A. Remove the restraints and provide skin care hourly. Option B. Document the condition of the skin every 3 hours. Option C. Assess the restraint every 30 minutes. Option D. Tie the restraint to the side rails. The correct answer is option C. Assess the restraint every 30 minutes. Restrained clients must be visually assessed every 30 minutes and documentation must be maintained according to protocol. Question 100. A client is 36 hours post-knee surgery and 270 milliliters of fluid accumulates in the drain. What should the nurse do? Option A. Notify the doctor. Option B. Empty the drain. Option C. Take no action. Option D. Remove the drain. The correct answer is option A. Notify the doctor. Excessive drainage from a surgical site should be reported to the physician for further evaluation. Question 101. A client taking Accutane tells the nurse she is pregnant. What should the nurse teach this client? Option A. The fetus is at risk for serious birth defects or teratogenesis. Option B. She has a reportable condition and must terminate the pregnancy. Option C. The drug is unsafe but can be continued with caution. Option D. The pregnancy should be followed by a genetic specialist only. The correct answer is option A. The fetus is at risk for serious birth defects or teratogenesis. Accutane is a Category X drug that is highly teratogenic and the client must be informed of the high risk of fetal harm. Question 102. Which of the following muscles is not part of the rotator cuff? Option A. Teres minor. Option B. Teres major. Option C. Supraspinatus. Option D. Infraspinatus. The correct answer is option B. Teres major. The rotator cuff is made up of the teres minor and supraspinatus and infraspinatus and subscapularis. Question 103. A patient has recently been prescribed amlodipine. Which of the following side effects should they watch for? Option A. Hypotension and angina. Option B. Hypertension. Option C. Lower extremity edema. Option D. Peripheral sensory loss. The correct answer is option A. Hypotension and angina. Amlodipine can cause a drop in blood pressure and may lead to chest pain or angina in some cases. Question 104. A family has multiple wives who are all sisters married to one man. This family structure is: Option A. Polyandry. Option B. Sororate polygamy. Option C. Non-sororate polygamy. Option D. Sororate polygamy. The correct answer is option B. Sororate polygamy. Sororate polygamy refers to a marriage structure where the multiple wives are sisters. Question 105. Which type of dressing is recommended for use after a chest tube is removed? Option A. A transparent dressing. Option B. Colloidal dressing. Option C. Petrolatum gauze. Option D. Non-adherent dressing. The correct answer is option C. Petrolatum gauze. Petrolatum gauze creates an airtight seal that prevents air from entering the pleural space after the tube is pulled. Question 106. The nurse supporting a family who experienced a sudden unexpected death knows that: Option A. Survivors have greater emotional turmoil and shock. Option B. Survivors have less emotional turmoil. Option C. Survivors have the same turmoil as an expected death. Option D. Survivors have little turmoil because they were not there. The correct answer is option A. Survivors have greater emotional turmoil and shock. Sudden death prevents anticipatory grieving and typically results in more intense shock and emotional imbalance. Question 107. Which direction to a nursing assistant is most likely to result in a timely urine specimen delivery? Option A, make it a stat delivery. Option B, please do it as soon as you can after break. Option C, we are worried about urinary sepsis. Option D, collect the specimen now and take it to the lab immediately. The correct answer is option D. Collect the specimen now and take it to the lab immediately. Clear and concise instructions with specific actions and timeframes are essential for effective delegation. Question 108. Falls in the elderly population are most likely to occur in those who are: Option A, in their 80s. Option B, living at home. Option C, hospitalized. Option D, living on Social Security only. The correct answer is option C, hospitalized. Elderly clients are at high risk for falls in unfamiliar environments like a hospital. Question 109. A 14-year-old boy becomes agitated and yells at the nursing staff. What is the first response? Option A, create an atmosphere of seclusion according to procedures. Option B, remove other patients from the area. Option C, ask the patient what is making him mad. Option D, ask the patient why he is doing this. The correct answer is option A, create an atmosphere of seclusion according to procedures. The priority is to contain the behavior and ensure safety through established seclusion or de-escalation protocols. Question 110. A client reports that someone is in the room and trying to kill him. The nurse's best response is: Option A, no one is in your room and let us get you more medicine. Option B, I do not see anyone but you seem to be very frightened. Option C, no one can hurt you here. Option D, just tell the person to go away. The correct answer is option B. I do not see anyone but you seem to be very frightened. Acknowledging the client's feelings and fear without validating the hallucination is the most therapeutic approach. Question 111. A client recently diagnosed with a terminal illness has stopped crying and is making funeral arrangements. This indicates: Option A, the client is giving up. Option B, the suicide plan may have been decided. Option C, the client has reached acceptance. Option D, the client is in the bargaining phase. The correct answer is option B, the suicide plan may have been decided. Sudden calmness and final planning after a terminal diagnosis can be a warning sign of suicidal intent. Question 112. A patient with a traumatic brain injury has a slower pulse and impaired respiration. This may indicate: Option A, increased intracranial pressure. Option B, increased function of the 10th cranial nerve. Option C, a sympathetic response to activity. Option D, meningitis. The correct answer is option A, increased intracranial pressure. Slower pulse and impaired respiration are components of Cushing's triad, which indicates rising intracranial pressure. Question 113. Which mineral is the most important to prevent the progression of osteoporosis? Option A, potassium. Option B, magnesium. Option C, calcium. Option D, a vitamin B12. The correct answer is option C, calcium. Calcium along with vitamin D is essential for maintaining bone density and preventing osteoporosis. Question 114. A retired doctor asks which type of cells create exocrine secretions. The correct answer is: Option A, alpha cells. Option B, beta cells. Option C, acinar cells. Option D, plasma cells. The correct answer is option C, acinar cells. Acinar cells in the pancreas and other glands are responsible for producing exocrine secretions. Question 115. A patient with acquired immunodeficiency syndrome is prescribed zidovudine. Which side effects should they watch for? Option A, weakness and shortness of breath. Option B, fever and anemia. Option C, hypertension and shortness of breath. Option D, fever and hypertension. The correct answer is option B, fever and anemia. Zidovudine commonly causes bone marrow suppression, which leads to anemia and fever. Question 116. Metformin, which is administered to clients with type 2 diabetes, is an example of: Option A, an anti-hyperglycemic agent. Option B, a hypoglycemic agent. Option C, an insulin analog. Option D, a pancreatic alpha cell stimulant. The correct answer is option A, an anti-hyperglycemic agent. Metformin is an anti-hyperglycemic that works by reducing hepatic glucose production rather than stimulating insulin. Question 117. A 4-week-old baby has colic and the mother is stressed from lack of sleep. Which technique should the nurse teach? Option A, distraction with red objects. Option B, prone positioning. Option C, tapping reflex techniques. Option D, neural warmth techniques. The correct answer is option D, neural warmth techniques. Neural warmth or gentle warmth can help soothe and lower the agitation levels of a colicky infant. Question 118. A patient suffered a left frontal lobe stroke. Which of the following should the nurse watch for? Option A, changes in emotion and behavior. Option B, loss of hearing. Option C, appetite and vision deficits. Option D, changes in facial muscle control. The correct answer is option A, changes in emotion and behavior. The frontal lobe of the brain is responsible for behavior and personality and emotional regulation. Question 119. A patient has recently been prescribed albuterol. Which of the following is not a common effect? Option A, tachycardia. Option B, hypertension. Option C, bronchodilation. Option D, sensory changes. The correct answer is option D, sensory changes. Albuterol is a bronchodilator that can cause cardiovascular side effects but does not cause sensory changes. Question 120. The nurse caring for a client with diabetes insipidus can expect the laboratory work to show. Option A, elevated urine osmolarity and elevated serum osmolarity. Option B, decreased urine osmolarity and decreased serum osmolarity. Option C, elevated urine osmolarity and decreased serum osmolarity. Option D, decreased urine osmolarity and elevated serum osmolarity. The correct answer is option D, decreased urine osmolarity and elevated serum osmolarity. Diabetes insipidus results in large amounts of dilute urine and dehydration of the blood. Question 121. The nurse is teaching a client about communicable diseases and explains that a portal of entry is option A, a vector. Option B, a source like contaminated water. Option C, a food. Option D, the respiratory system. The correct answer is option D, the respiratory system. The portal of entry is the path such as the respiratory or gastrointestinal tract through which a pathogen enters a host. Question 122. After securing a client's safety from a faulty electric bed, what should the nurse do? Option A, discuss the matter with significant others. Option B, document the incident in the client record. Option C, notify the physician. Option D, prepare an incident report. The correct answer is option D, prepare an incident report. An incident report must be completed for any equipment failure or safety incident according to agency protocol. Question 123. The token economy is a type of therapy that focuses on option A, play therapy. Option B, behavior modification. Option C, milieu therapy. Option D, associative learning. The correct answer is option B, behavior modification. A token economy uses positive reinforcement and rewards to encourage desired behaviors in a therapeutic setting. Question 124. A dentist uses an anesthetic gas also known as laughing gas for wisdom tooth extraction. This agent is option A, nitrous oxide. Option B, nitrogen. Option C, nitric oxide. Option D, nitrogen dioxide. The correct answer is option A, nitrous oxide. Nitrous oxide is an inhaled anesthetic commonly used for minor procedures and dental work. Question 125. How is the information documented on hospital incident reports used? Option A, to analyze risk categories. Option B, to ensure procedures are in compliance. Option C, to identify staff educational needs. Option D, all of the above. The correct answer is option D, all of the above. Incident reports are used for risk analysis and quality improvement and identifying areas for staff training.